Hello guys, so this is my last wisdom teeth update. I took them out. I had surgery and it was about a month ago, and I'm going to talk to you about my recovery and the process and the consult appointment. So let's begin. So I had my consult appointment in July, and they just did an x-ray of my teeth, and then the surgeon talked to me after about why it's a good thing to get your wisdom teeth out, especially mine, because all of mine were impacted and one of the four was not coming up, and that was a big problem too, because that can lead to infections or like decay of the tooth or something like that. So we wanted to take them out for preventive reasons. Nothing was wrong, but it was gonna be a pain when I got older and it was still in my mouth. And it was really good. It was like a hour appointment, and we just talked, and then we went over some information about the care afterwards, the recovery time, and the doctor was really polite and really nice. I had a really good surgeon, and his team was really great. So I felt really grateful to have great staff that worked there and stuff like that. And then I scheduled my appointment for late September, so it was the last weekend of summer, and I started school that following weekend or that following week. So I had at least a 3-day recovering time of not doing anything. And then I got my prepared kit. I can say prepared kit, like I got my pain pills, my antibiotics, and before you go in for your wisdom teeth surgery, you have to take a mouth rinse. It's like mouthwash. Like I take mouthwash every day, but it's a special kind to prevent infections and stuff, and that includes antibiotics too. So I started that one day before surgery. I couldn't eat anything for 10 hours at least, no drinking, and I had to take my antibiotic the night before too. So that just means you have to keep up on your regimens and stuff. And then the reason why I didn't drink or eat for 10 hours before surgery was it prevents getting sick. So when they put you to sleep, when they do the surgery, it kind of makes sure that there's nothing in your stomach, so you can't like throw up or anything. And then I went to my appointment. It was at like 10:50 a.m. and it was a Friday, so I got in, I checked in. Shortly later, I went in the operating room, and my mom couldn't come with me in the room. It was just the nurse and later the surgeon. So I had an IV sedation, and that means I was put to sleep by an IV. I had a blood pressure cuff like right here the whole time before I went to sleep, and when I woke up I had it on, and that was to monitor my blood pressure. I also had a finger heartbeat thing. It was on my pointer finger, and they put like, it's like a clip, like a close clip, but it has a red light on it, and that was to monitor myself, or they monitoring me. And then I had 3 heart monitors, 2 like on my chest area, and then 1 on my stomach, and that was just to make sure they could check on me during surgery. And that was all the things I had on me, and of course I had an IV thing, so that was hanging from the ceiling, of course, so I couldn't really move my arm. But the surgeon came in, he did the IV thing, and I was out in like 2 minutes. I did not want to keep my wisdom teeth really, like I could, but I didn't mention it to the surgeon. But when I woke up, I felt, I knew what happened. So I knew from the state of mind, I knew what happened, but my jaw was in the most pain ever, because when they open your mouth, it's like that for like 45 minutes at the most. And they numbed my chin and my lips. So when I fell asleep, they did shots in my mouth. And then they took care of my teeth. I had invisible stitches. And then I woke up an hour later. I had a big band of ice pack on my face. It's like oh no, it goes all over my face. And then the ice pack was here. I was not swollen. It was just painful. My jaw couldn't really move. But I could talk a tiny bit, but that was just the most painful thing ever. Like right when I woke up and I opened my mouth, it was just like instant. And then I was tuned out. I was mellow. I was just like, because the like drugs they give you is still in your system, and it will be in your system for like a day after the surgery. So I felt I felt sick too. And I had gauze in my mouth too. So for each side, I had like a tube of gauze, and that's to help it stop bleeding. And when you talk, you chew on the gauze, but you can't really talk that well. And I didn't really talk. I was just listening to like my mom and the nurse talking to each other, and I was like, I couldn't do it. And then I got home maybe at 11:30, and I had to take my antibiotics, and that was 3 times a day for 10 days. And that is just to prevent infection and stuff, because you don't want an open infection. But I did have holes in my gums, so I had 4 holes. The bottoms are the worst. The top ones, I didn't really care about my top ones. Like, that didn't really hurt me, but the bottom ones did affect me a lot. When I had my wisdom teeth out and after, I had stitches. So they didn't close the hole all the way, because that would be bad. So they just closed it part way so it could still breathe and close by itself, and the skin and the tissue could heal it by itself. But the stitches lasted for like maybe at least 5 days, and it was invisible stitches, or like no, it was dissolvable stitches. You could still see the stitches. It just fell out by itself. It was not invisible, but it was like white string that looked like invisible string. But it was my first time having stitches, so it was just like, oh my, in my mouth ever? I had stitches for my first time, and that was a planned stitch moment. It was planned. Like, I knew I was gonna get stitches. So I was on the couch like all day, and the following day, and then I got up and I started moving a tiny bit. I did take a tiny walk with my dad the day after, and that was around like 3 blocks, but I was still out of it. I got sick because the painkillers could make you feel sick and nauseous, so I didn't feel nauseous really, but the medicine was not sitting in my stomach really well, so I did get sick. And then I slowly got better. I got my energy up, and then I had a checkup appointment. So a week and a half later, after my surgery, the surgeon wanted to see the holes and how they're healing, and then he gave me this. And also, you have to take mouthwash for 2 weeks, two times a day, and you have to rinse for a minute, so it kills like bacteria, and it just makes your gums really healthy. But this is really cool. And also during my surgery, I had my surgeon and 2 nurses, and one of the nurses were there before, after, and she helped me up to the car. So when I got to the car, they had to hold on to me. Like, they were like wrapped my arm around like her arm, because I said I could walk, but still she said, no, you still need to hang on to me. And then when the IV was out, I saw the Band-Aid, and when you lifted the Band-Aid, you could just see blood oozing, and it was just like, and I was just like staring at it for like 5 seconds, and then the nurse said, leave it on, leave it on. So I listened to her about that, and then when the nurse got my mom to talk and take me home, it was just funny. I took my blood pressure cuff right here, and it just kind of like gently threw it on the ground, and when the nurse came in, she noticed, and she said, you need to leave it on. It was just kind of funny, because you could just hear the big bang, and the nurse was like, no, you need to leave it on, but she was really nice. All the staff there was really helpful, and it was great. So when I arrived for my 2-week post-op appointment, week and a half, the surgeon checked on me. They said it's healing really well. The stitches were completely gone. The holes were getting smaller. And the gums were doing its job. And the tissue, of course. But this is to clean the holes. But before that, I was only eating pudding, Jell-O, ice cream bars, applesauce, and oatmeal for 2 days post-op. And then day 3, I started eating meat and some lettuce after 5 days. And you could see the food you eat get stuck in the holes. So when I checked multiple times a day, of course, I saw the stitches, and then I saw food particles or just food things in my holes. And I didn't have this because I didn't go to the doctors until a week and a half post-op. But I had to swish my mouth with water and then slowly spit it out. And I couldn't drink from a water bottle. They gave me a water bottle with a spout, kind of, so you just drink it like that. And stuff like that. So this is a syringe. You fill it up with water, and you just do this with the water in your mouth. And I needed help like seeing my holes, because you can't really see your holes. It's way back there, but like when you have a mirror and stuff, you could probably see a little bit. But my mom had to do that most of the time for me, because it's kind of impossible to see where the hole is from this angle, because if you get like a different perspective, then it's just like, oh. Well, I did do it one time, and it was my very first time, and I think it was this one. I started with this one, and I put it like in the hole, and blood started to get everywhere. Blood was just squirting up, getting all over my teeth, all over my gums. It was disgusting. Well, yeah, and I did this when my mom was asleep. So I did this at like 11 p.m. and she didn't know what happened. So the next morning, I told her what happened, and then she helped me ever since. But that was such a bad experience, because you just see the blood dripping down all my teeth and out the hole. And of course, there were still stitches there, but it didn't ruin the stitches. But it was just like, oh my gosh, what happened? But that was like a panic attack, kind of. I was like, I want to wake up my mom, but it's not like serious enough where I have to. So it was just, oh wait. So I did this with all of my, not all of my holes, but both of my bottom holes. The top ones, they said you don't have to do it. Nothing's gonna get on top of your mouth, usually on the bottom. So you do this, they said 3 times a day, but I was pretty bad at it. I did it at least 2 times a day, morning and night. But I think they suggest doing it after every meal, so that's why they say 3 times a day. But at least I did it 2 times a day. And then you just squirt it like this, and then you refill it, and I did it 2 times in each hole. and that lasted like, it was only a 2-minute process, and I did this straight for a week. So I stopped using it, but I still have it for this video. It was just really interesting to be doing this a week and a half later, because I was eating meat and vegetables after day 3. So, like solid food. But besides that, I was just like, oh my, I see lettuce in my tooth. And then now, it's been a month later. I had my surgery a month ago, and I still get, if I was going to eat a carrot, like I ate a carrot for lunch yesterday, I don't know, but there's still food that gets back, maybe not in the hole, but maybe around the hole. I thought it was in the hole. And of course, you just see a tiny piece of food like that. And then also, before swishing with water, I press on the side of my gum, the outer side, and I like pressed it a little bit, and food started shooting out too. But it was pretty disgusting. It was just like, wow. It was like a big piece of, it was big because of course the hole was big. But everything is healed up. But that's my last wisdom teeth update. My final one. I don't have my wisdom teeth anymore, and I noticed that I can eat a lot better now afterwards, because my wisdom tooth was covered by the gum, so every time I chewed it kind of was painful. So that was a great thing, so I can eat better and there's no tissue or gums in my way. And oh yeah, of course, I was like day 5, and I was just like, it was painful, but it was just the healing process. We called the surgeon, and I said, it's so painful, like when you touch it, just a tiny bit, it hurts. And now it's gone. So I'm pretty happy that I'm totally done with this. I don't have to face with this ever again, and I'm just happy that the outcome was great, and I didn't have to stress out with just like getting an infection. And of course there's still a chance now because it's not fully healed, but I think I still have 2 more weeks until it's like completely out of the question. But I do feel food getting stuck back there. So that's my last wisdom teeth announcement. I'm done. Hooray! It's good to get out of the surgery center and out of the post-op appointment and out of recovery mode. So I'm officially done. So I'm done with the antibiotics, done with the mouthwash, done with the syringe, done with the pain pill. Yeah, pain pills. I only took 1 pain pill. And then after that, I took ibuprofen or Tylenol afterwards if I needed it. But I was in no pain when I woke up from surgery, just my jaw. But that's basically it for my update. Thank you so much for watching. I remember I started my update a year ago, and it was great to document all of this. Like, this is just something to look back to, and when I have kids someday, I can have a reference of what I did and the process of my wisdom teeth and stuff. So, great thing I have this video to remember things. So, that's it. Thank you so much for watching, and I'll see you in my next video.